Cardiovascular diseases including hypertension due to elevated blood pressure. Type 2 diabetes is considered to be a common complication of chronic exposure to glucocorticoid excess, which stimulates gluconeogenesis and the development of insulin resistance. Dyslipidemia. Glucocorticoids excess could stimulate both lipolysis and lipogenesis, resulting in increased intravascular triglyceride hydrolysis, hepatic free fatty acid production. Infertility. Hypercortisolism can interfere with the development of normal follicles, inhibit ovulation. In men, this can lead to fewer sperm production and worst is impotence. Infections are prevalent in PT with ectopic ACTH syndrome, by the very high plasma cortisol concentrations that causes a severe immunocompromised state. To detect Cushing's syndrome, the following are performed. Dexamethasone suppression test measures the response of the adrenal glands to ACTH by administering 1 mg of dexamethasone orally at 11 p.m., and a plasma cortisol level is obtained at 8 a.m. the next morning, and this usually confirms the diagnosis of Cushing's syndrome. Next is the stimulation test. In a stimulation test, administration of metirapone, which blocks cortisol production by the adrenal glands, tests the ability of the pituitary gland and hypothalamus to detect and correct low levels of plasma cortisol by increasing corticotropin production. Imaging studies such as ultrasound, CT scan, or angiography to detect adrenal tumors and identify pituitary tumors. A patient with Cushing's syndrome includes an increase in serum sodium and a decrease in potassium levels. Indicators of Cushing's syndrome include an increase in the blood glucose levels, a reduction in the number of eosinophils, and disappearance of lymphoid tissue. UFC levels correlate with free plasma levels of cortisol. The patient collects 3 24-hour samples of urine for analysis. Normal urine cortisol is less than 100 micrograms per 24 hours. A result that is 4 times the upper limit of normal, typically 440 micrograms per 24 hours, which is rare, indicates Cushing's syndrome. If Cushing's syndrome is caused by pituitary tumors rather than tumors of the adrenal cortex, treatment is directed at the pituitary gland. Surgical removal of the tumor by transsphenoidal hypophysectomy is the treatment of choice and has an 80% success rate. Radiation therapy is also widely used in patients with pituitary tumor, although it may take several months for control of symptoms. Adrenalectomy is the treatment of choice in patients with primary adrenal hypertrophy. Postoperatively, symptoms of adrenal insufficiency may begin to appear 12 to 48 hours after surgery because of reduction of the high levels of circulating adrenal hormones. Nursing diagnosis: risk for injury related to weakness. Risk for infection related to altered protein metabolism and inflammatory response. Self-care deficit related to weakness, fatigue, muscle wasting, and altered sleep patterns. Disturbed body image related to altered physical appearance, impaired sexual functioning, and decreased activity level. Disturbed thought process related to mood swings, irritability, and depression. Thanks for watching.